Actually, if you bring an empty flash drive here, we can put a copy of it on you when you come in next time. Nope. There you go. Basically going to cut around that. This is a shaver tool, so it's going to chomp up all that stuff that you just trimmed off and then smooth out that edge. It sucks it out through the center of that instrument.
Is that water that comes out of that or something?
Yeah, well, there's saline that they're running through your knee during the surgery, so those bubbles are from the saline that they're kind of flushing through the knee at the same time. It's not coming out of that as much as there's a little scab you have on the outside of the knee. That's where that saline line was put during surgery.
Is there going to be a lot of bone on bone now that that's no?
It doesn't change if you leave the piece in or take it out, because it's not, obviously that part's not working properly. And so when people say, well, if you take out the torn piece of meniscus, am I going to develop an arthritic change? By having the meniscus tear is sort of the start of the joint getting some wear. So you can leave those tears in if they don't bother people enough. You can take them out, but it doesn't really change how that joint force is distributed. Whether you take it out, it's just a matter of, is it painful enough that patients say, you need to take this out. I can't play basketball. I played basketball when I had so much pain that night.
It's sucking it out of there?
Yeah, that's a hollow tube, so that'll just take those things that it cuts and sucks them out at the same time. This is your ACL right here. That's your ACL right there. And this is your lateral side. This is the outside part of the knee, so that's your lateral meniscus. That's what normal meniscus looks like. So obviously you could tell the difference between the side that was torn and not torn. So again, he's just looking in there just because he's in there, just kind of label no cartilage defects or anything on the outside part of your knee.